Hello, fellow healthcare practitioners. My name is Seamus Bingham. I'm a student physical therapist with Florida Gulf Coast University. Today we'll be talking about patient-centered initiatives for tobacco cessation in primary healthcare settings. Tobacco kills around 6 million people each year and is the leading cause of preventable death in the U.S. Nearly 1 in 5 premature deaths is attributed to tobacco use. Something we can do as healthcare providers is something we do on a day-to-day basis in health coaching, synonymous with wellness coaching, essentially facilitating healthy, sustainable behavior change in our patients by using their own values and motivations to transform their goals into action. We want to incorporate their learning styles, whether they learn best from reading and writing words, visual input, what they hear, or by doing with hands-on technique, or a combination of any of these. We want to overcome some communication barriers using simple language, active listening skills, and considering the patient's emotional state, not giving them too much information at once and burning them out. We want to promote long-term sustainability, and therefore, another thing we want to be focusing on as healthcare providers is effective listening skills. And as healthcare providers, we tend to have a writing reflex that we know the answer and what we want the patient to do, so we tell them what to do. Rather than that, we want to be gathering information rather than imposing ideas. So something that has been shown to be helpful is waiting 3 seconds after the patient stops speaking before developing a response, and asking if there's anything else why this is important to the patient. So just keeping the patient the priority, asking supporting questions, open-ended questions. Those have been shown to be the best. And writing down our own motivations as we see our interactions with patients so that we can identify our own impulses to impress and influence the patients rather than drawing out their ideas and using those to support their health changes. So we want to be open to the dialogue, ours and theirs, be mindful of this, and not generalize or prejudge any statements. And rather, we might be breaking their statements down into time frames or segments so that they're more easily understood and we get the context that they're in. A strategy that has been really evidence-based is called motivational interviewing, which is goal-oriented. It's centered around the patient to resolve their ambivalence or their reluctance to change. It's non-judgmental, very important. We don't want to convince the people to change or trick them into change. We're really just finding out why it's important to them and using those reasons, reminding them, active listening, repeating back in a thoughtful manner why it's important, weighing those pros and cons, collaborating with the patient rather than being the authority figure and telling them what to do, supporting their autonomy in their health behavior change. So if they're ready to change, brief intervention has been shown to be very effective. Even 5 minutes has been shown of brief counsel to be effective in health behavior change with patients. So we can ask about their tobacco use, we can advise them to quit, assess their willingness to make a quit attempt, assist in the quit attempt, and arrange a follow-up. And then for those patients that are unwilling to quit at the time, we can discuss why it would be relevant to them, weigh the risks versus the rewards of quitting, identify possible roadblocks to quitting, and then just repeat this until they're ready to move on in the process. We want to express empathy and we want to roll with resistance. We don't want to push back. We just want to, if they're not very open, we want to be open to that. We do not want to discredit them because of their unwillingness to change. We want to help them identify that and the reasoning behind that, and then supporting their self-efficacy or their confidence level in their ability to realize their health behavior change. We can ask open-ended questions. We can use the reflective listening. So, tell me about your quit smoking plan. How are you going to do this? And then if they're not ready yet, you say, oh, well, you've tried in the past. Well, you feel like the time is right now. That would be an example of a reflective statement. And then affirming, you can congratulate them on their progress for cutting down to 3 cigarettes per day, and then summarizing from their prior statements to support their continued efforts, such as they cut down last week and they were feeling great. So remind them of these small successes, because as they master these, it's going to increase their self-efficacy, and when their confidence goes up, they're just going to continue with the upward spiral and really just get into the change talk that we're trying to inspire. Desire instead of I need to, I have to, I want to commit, I will, I am going to. What's the reasoning behind it? Why is it important? And then developing a change plan which is specific, measurable, attainable, reasonable, and timely. So instead of just saying, I will try to quit, starting Monday, I will cut back on 1 cigarette per day until I have reached 0 cigarettes. That would be an example of a change talk and developing a change plan. Now, thank you for being involved in this educational seminar. I look forward to discussing these topics and principles of motivational interviewing, health behavior change with you further. Thank you very much.